One of the first things I was asked to do was to look at the subject of treatment for these physicians. There's a whole area of study, a whole industry that's devoted to dealing with doctors accused of sexual misconduct.
If you don't believe in therapy, it's all right with me, but the checks and balances systems are really helpful. Post-treatment, with cognitive behavioral treatment that I've outlined, and the check and balances I've outlined to you, the recidivism is 1%. 99% success. So if you return a treated, sensitized doc who's gone through this process, the chances of their getting involved in this is really low because the success rate is 99%.
Over and over again, you see a real culture of deference to physicians, concern for the physicians, their reputations, their status, concern that the physician, if he, and it is usually a he, is able to practice, that he be allowed to continue to practice. And I'm not sure that the same concern is given to patients.
These officials, these employers, the heads of these organizations, again, whether it be a church or a medical society, have a default assumption that we've got to protect this man's career. We've got to protect this man's reputation. And at a certain sort of psychological level, that makes perfect sense because the accused is an adult, and a powerful adult, and the decision makers are powerful adults. And so it's not hard for them to imagine themselves being accused of sexual exploitation. Therefore, they recoil in horror at taking decisive action against somebody who is accused, somebody who's just like them.
If it's a doctor that one time may have stepped beyond the line, he may thought he had an attractive patient, something like that, that I may agree with because rehabilitation does work in certain instances. But multiple charges, multiple offenses, doesn't have a care in the world that anybody will ever bring him to justice and continue, I do not believe rehabilitation would work. It should be known where it's my choice that I choose that doctor because I spoke to him and I trust him that he has been rehabilitated. That should be public knowledge.